እንደምን አረፈዳችሁ ተመልካቾቻችን። ዛሬ ይዤላችሁ የቀረብኩት በሆስፒታላችን ቬጅታኒ የልብ ቧንቧ ቀዶ ጥገና ያደረጉትን አቶ ኃይሉ ካሳንና በቅርብ ሲከታተሏቸው የነበሩትን ቀዶ ጠጋኝ ሐኪም ወይም ካርዲዮ-ቶራሲክ ሰርጅን ዶክተር ፒያን ነው። በሆስፒታላችን ስለነበረው የሕክምና ሂደት አንዳንድ ነገር ጠይቃቸዋለሁ። ሁለቱንም በጥሞና እንድትከታተሉኝ እጋብዛለሁ። በቅድሚያ የምጠይቀው አቶ ኃይሉ።
እኔ ስሜ አቶ ኃይሉ ካሳ እባላለሁ። የምተዳደረው በንግድ ስራ ነው። የመጣሁት ከኢትዮጵያ ነው እና ከ3 ወር በፊት የህመም ስሜት ሲሰማኝ አዲስ አበባ ለነበሩ ዶክተሮች ሳማክር ሶኬ የተለያየ ነገር ስለ ታይላንድ ባንኮክ ከኢትዮጵያኖች አወሩልኝ። በሚያወሩልኝ ጊዜ ኦኬ እኔም ለመሄድ ወሰንኩኝ። ከዛ ወደ ብሪታንያ ሆስፒታል መጣሁ። ብሪታንያ ሆስፒታል ኢመርጀንሲ ውስጥ ተኝቼ አይ ለማንኛውም ዛሬ ዶክተሩ ይመጣል፣ ዶክተር ፒያ የሚባል ይመጣል፣ ለማንኛውም እሑድ መጥቶ አነጋገረኝ። በስፋት ልክ ያነጋገረኝ ቢያንስ 2 ሰዓት ተኩል የፈጀ አነጋገር ነው። ያው ተቀምጦ አይደለም ቆሞ ለኔ ጊዜውን ሰጥቶ መስዋዕትነት ከፍሎ እኔን በማረጋጋት ትሪት በማድረግ ለዚህ ድረስ ገንዘብ የሚኖረኝ በገንዘብ ብታከም ከገንዘቤና ከእግዚአብሔር በታች እሱ ነው ለዚህ ለመናገር ያበቃል።
ምንድነው የተደረገሎት ህክምና? በዚህም ስለዛ
የተደረገልኝ ኦፕሬሽን የተደረኩት ከ12 ሰዓት ጀምሮ ከኔ ህይወት ጋር ህይወቴን ተከታትሎና ለህይወቴ መቋሚያ በጅቶለት ለዚህ ያደረሰኝ። ከዛ በተረፈ ከኦፕሬሽን በኋላ ዶክተር ሃና ሁሉም ሰራተኞች ከታች ጀምሮ እስካላሉ ሰራተኞችን ሳላመሰግን አላልፍም።
ስለዚህ ከህመሞት አሁን ፋታ አግኝተዋል ማለት ነው።
በሞላ ኖርማል ሰው ሆኜ እንደዚህ ነገራለሁ፣ እበላለሁ፣ እጠጣለሁ፣ የፈለጉትን ሰናለሁ እና እንደገና ተፈጠርኩኝ እንደገና እንደ አዲስ ከደስታ በላይ ሁሉም ሰራተኛውን አመሰግነዋለሁ።
ስለ ሆስፒታሉ የሚሉት ነገር አለ?
ስለ ሆስፒታሉ ማሩ ሰራተኞቹ ጥሩ ሰራተኛ አለ። ሆስፒታሉ ጥሩ ሆስፒታል ነው። ስሙ የተጠበቀ ነው። ትልቅ ነው። በትልቅነቱም በሀገራችን በጣም እየተወራለት ነው።
Dr. Piya, thank you for joining us for this interview, and I'm going to ask you some questions regarding this case. So, what was the general condition of this patient before he came to our hospital?
When he came to our hospital, or Vejthani hospital, his general condition was very poor. He came with the very low cardiac output state because of the poor cardiac function or poor heart function, because as a result of the myocardial infarction from the occlusion of the coronary arteries. His coronary arteries had all 3 major vessels of the blood supply to the heart were occluded by the atherosclerosis or the disease of the wall of the vessels, and thus he cannot live longer if we did not treat or if he has no any treatment before.
So after just noticing all these symptoms he has, what was your treatment plan?
Yes, okay, because of the high mortality of the disease, and in general, statistically, in this kind of patient, they cannot live longer. So the surgical treatment is the only one option, surgical treatment. So I plan to do the coronary artery bypass graft surgery, or we call the CABG or CABG, that can provide the ischemic heart by the provide the blood supply by doing the bypass graft to 3 vessels.
after the surgery, what is the prognosis of the patient? And
The surgery
Yeah.
was successful as planned because we can use the best arteries. I mean the best graft from his chest wall. Yeah, we use the internal mammary artery, which is a small artery supplying blood to the chest wall, and we move it and connect it to the coronary arteries, giving blood supply to the left ventricle, which is the most important part of the heart. The rest of the grafts, we use the saphenous vein graft from his right leg to connect to the rest of the occluded vessel. After this, if Hailu takes after his health in good condition, he can live longer than 10 years.
Thank you, doctor. And how is the general condition of the patient after the surgery?
Yeah, after the surgery or successful surgical treatment, his general condition has been improved a lot. For example, before surgery, he could not do anything without chest pain. But because, when he want to do something, he was very tired, and also he had to stay on the bed only, and his general condition was very poor. But after the surgery, he can walk, he can move out of the bed within a week after the operation. After the operation, he can walk for a distance without any chest pain, right? And without any tiredness.
Okay, thank you, doctor, for your
You're
brief
welcome.
explanation about the procedure.